And this is Cindy Winters, and I want to thank you all for joining us today. For the next 30 minutes, as Jen and I will share our experience in creating a food environment action team and the work that they've been able to accomplish to increase access to healthful food options. The Food Environment Action Team is part of the overall structure of the community leadership of the Heart of New Ulm project, which started out as a 10-year research demonstration project to reduce heart attacks in the rural community of New Ulm, Minnesota. The research project ran from 2009 to 2018 and continues today as a community-led and community-driven health improvement initiative. The objectives for our webinar are to help you understand how auditing the food environment can help enhance our work to provide healthful options and to understand the role a team of residents can play in changing the food environment. To set the stage for our work, you need to understand a little bit about New Ulm, Minnesota and what we were up against. Beer, brats, and butter. New Ulm is home to the second oldest family-owned brewery in the United States. It's also the home of AMPI, which produces 10% of the butter worldwide. New Ulm self-identifies itself as the most German community in the country, with 40% of the residents being direct descendants from Germany. And you know what goes with the German heritage and beer, brats, of course. These were the three major food groups in this small rural community of about 14,000 when we started. It was nearly impossible to find a green vegetable on any restaurant menu when the project started. So you won't be surprised to learn that our community diagnosis told us about the health of our residents. After looking at the electronic medical record data for our target population of adults 40 to 79 years of age and collecting health behaviors through surveys, we found that 76% of our target population were either obese or overweight, and 38% of them had metabolic syndrome. Only 17% consumed the recommended amount of 5 or more servings of fruits or vegetables a day, and that included the sauerkraut that they put on their brats. 64% of them were getting the recommended amount of physical activity on a daily basis. So it's no wonder that we decided we needed to address the food environment to increase the consumption of fruits and vegetables. Now we're going to have a couple of poll questions so we can understand where you are at in this work, trying to improve the food environment. The first question that John's going to put up in the poll is, what are you currently working on? Are you currently working on improving the food environment in your community? We'll give you a few seconds or minute to answer those questions. Oh, good. So about 67% of you say that you are working on it, and 28% say that you're considering it. So good. Hopefully this webinar will be beneficial to you. So if you are working on the food environment or improving it, you've been working on it. So your options are haven't started yet, 1 to 6 months, 6 months to a year, 1 to 3 years, 4 years, or 5 years or more. And the majority say that you haven't started yet, and the ones that are working on it, it's 13% say they've been working on it for 1 to 6 months, and that 31% say that they've been working on it for 1 to 3 years. And there's 19% that have been working on it for 5 or more years. Well, that's good to know. And we know that this work doesn't happen overnight, and it does take a long time to see change. And so the last question that we're going to ask is, have you ever done a food tour in your community? It's similar to a walk audit. And the responses are yes, no, And is that a thing, doing a food audit or food tour? And 65% said that they haven't done one. 24% said they didn't know it was a thing, and 12% said that they've done it. So I hope that the 12% that have done it found it really beneficial. And this webinar today will help you understand why we did it and how we did it. But first, we want to talk about a little bit more about the project overall. So the Heart in New Ulm started out as a 10-year research project. And over the course of that time, the Rural Health Transformation Center staff learned many valuable lessons in working with the community. And one of those lessons is that you can't expect to spend 10 years in a community conducting the research and then walk away with your results and lessons learned. Our partners and community members invested a lot of time and energy into the project to make it successful. And we needed to come up with a sustainability model that could maintain the momentum and carry on the work after the research concluded. This is the model that we developed as we identified the key components sustaining the project long term. And as you can see from the model, data and evaluation is a continuous cycle. Data is collected from a variety of resources to determine initiatives and is part of the evaluation process to measure the progress. After we knew more about the health of our target audience and the lack of fruit and vegetable consumption, we needed to understand the residents' dining behaviors and what dining options were available in the community. We needed to do more data collection to help determine what evidence-based strategies to implement to make the best use of our time and resources. So we conducted a food environment assessment. By conducting community surveys to better understand where the residents obtained their food, we discovered that of those that participated in the survey, the residents ate out an average of 2 times per week. At those restaurants the residents frequented weekly, only 59% offered a non-fried vegetable on their menu, 41% offered fruit, 29% offered smaller portions, and 26% offered whole grain breads. And 1 in 4 found it challenging to identify healthy options on the menu. As a result of our findings, we developed a restaurant recognition program. Our webinar last month went over the restaurant program in greater detail, so I'm just going to touch on the highlights of the program. We developed a list of criteria the restaurants could work on to improve their healthy practices. The criteria was incremental in making changes the restaurants could easily do, and we provided them with the training, information, and incentives they needed to move them from one level to the next over the course of the project. To learn more, you can access the webinar entitled Improving Restaurant Food Environments to Support Healthful Food Options on our website at mhifpopulationhealth.org/RHTC. John has put the link to the website in the chat box. As John mentioned in the opening of this webinar, you'll receive a link to the webinar recording via a follow-up email. In order to meet the community where they were at, while we were working on incorporating healthy practices in the restaurants, we wanted to recognize what the residents were doing right. So on the right side of the screen, you'll see that we created the t-shirts stating that kraut is a vegetable. They're very popular in the community, and people wore and still wear them with pride today, especially around Oktoberfest time. One of the components of our sustainability model involved creating a leadership team to guide and direct the work that needed to happen in the community, according to our community health improvement plan. We shifted the work from being done primarily by staff in the early years to residents in the community that had a particular passion for one of the areas in the plan. We chose to call these groups action teams. They were created to get more residents and organizations involved in doing the work. People are either recruited to join because of their association with organizations that have expertise in the area, and others join because they want to make a difference in the community and they understand they play a role in improving a particular sector. After we switched to the sustainable leadership model, we went from a 36-member steering committee that met quarterly to a 12-member leadership team that meets monthly and coordinates the work of 8 action teams. We now have about 70 volunteers from 27 different organizations that are actively involved in the work of the Heart of New Ulm project, and the number of staff FTEs has dropped dramatically. So one of our action teams is the team that's working to improve the food environment. We created our Food Environment Action Team, or FEAT for short, in 2017. The size of the team varies as the initiatives they are working on changes. But today we're going to concentrate on the overall structure of the team and highlight a few of the initiatives they've done over the course of the past 2 years. The Heart of New Ulm has an overall mission for the community, but it's important for each of the action teams to have a mission focused on their particular sector, so everyone on the team is on the same page. Team members come and go, so having a mission helps the new members understand what the team is trying to accomplish. The mission of the Food Environment Action Team decided its mission was to develop and support policies and practices that improve the access, availability, and identification of healthy food venues in New Ulm. Having this mission in place has really helped them focus their efforts on the work that needs to be accomplished. And the action team has aligned their community priorities with the priorities of some of the food initiatives happening across the state of Minnesota. Minnesota has a statewide health improvement partnership that is funded through state dollars to address physical activity, nutrition, and tobacco use prevention through policy systems and environmental change. We also have a Minnesota Food Charter, which is a roadmap designed to guide policymakers and community leaders in providing Minnesota with equal access to affordable, safe, and healthy food, regardless of where they live. This access improves the health and well-being of residents and also has the potential to significantly improve the state's economy. The advantages of aligning priorities with other state or local initiatives gives the team access to other organizations with a similar focus. It expands the resources that are available to support the work. It helps to reduce duplication of services and frees up resources to help fill gaps. Priority alignment also helps you identify how you can partner. Sometimes you know there should be a fit and you should be working together, but you aren't quite sure how. It can also help identify how the organizations around the table complement each other and provide support. The members of the team were either recruited because of the role they play in the food environment in the community or because of their particular interest in improving the food environment. It's important for the members to understand their roles and responsibilities on the team. It takes time for teams to form a cohesive group and develop trust if they haven't had the opportunity to work together before. This is a list of our partners, but yours will look entirely different depending on the makeup of your community and the resources available in your area. As you can see from our partner list, we have a couple of regional partners, the Minnesota Extension and Lutheran Social Services, and even a national partner, the Sustainable Farming Association, as members of our team. They all bring a different type of expertise and knowledge to the table, along with access to their networks. Expanding the reach into our partners' networks allows the team to gain new skills and knowledge in addressing the food environment. It's important to build the capacity of the team to address the various challenges in the community around healthful food options. Asking the organizations around the table to share their expertise and sharing the latest research are easy ways to build that capacity. You can also bring in local or regional experts to conduct a training for the team and interested community members. Or send team members to conferences and ask them to bring the information back and share it with the rest of the team. It doesn't always have to be the facilitator that attends conferences or trainings. Attending conferences and trainings allow the participants to expand their networks and learn what's happening across the region or state. Now I'm going to turn the webinar over to Jen Maurer, who facilitates the Food Action Team, so that she can tell you about the food tour they conducted in Ulm and the results of conducting that tour.
Thank you, Cindy. As Cindy stated, the Heart of Ulm project has worked with restaurants, grocery stores, convenience stores to increase the availability and promotion of the healthy menu items and help consumers make healthier food choices. While great progress was made, we knew that opportunities still existed to accessing the healthy, affordable foods throughout the community. So this sparked a lot of questions that the action team had about the current environment, and we knew as members of the team we wouldn't be able to answer all of them on our own. So to get a better understanding of the community's opportunities, the barriers, what kind of impact our team could even have in the community, we decided to set up the food tour. So we looked at who wasn't at the table and wanted to get a better understanding of what was happening across the community, from youth all the way to the senior population. So these are the locations that we picked. We picked the high school because it had just been built. They have an industrial sized kitchen. They built a greenhouse as well as some aquaponics, and had some really neat new initiatives that were started that not too many people actually knew about. One thing that they were doing is they were planting vegetables, and then they were taking them to the local co-op and selling them. So that was one thing that we didn't even know about until we did the tour. We also stopped at the local food shelf because a lot of us had never been there before. They had just done an expansion, had got some freezers and fridges and things that it was great to see that we didn't even know they had. We went to the local co-op, which was fairly new, our community garden. We went to a restaurant which had been a part of the Heart of Ulm restaurant program since day one and was one of the gold level restaurants. So we checked their menu out and talked to them about their role with the project from the beginning. And then we went to the aquaponics facility, which was very new and really only one person on our team had ever heard of. So as you can tell here, just some additional pictures from the tour that we took. One thing, so as we were going around and checking out the facilities, we wanted to ensure that we were taking pictures of what we were seeing and then putting it on social media. We created a press release, put it in our newsletter to tell the community about the food tour that we were doing, to let them know about these locations and some of the great work and things that are happening in the community that us who are really close to the food environment didn't even know all about. So it's just a great learning too for the community. So I recommend if you do a food tour in your community to take pictures and to share what you're learning with others. So the tour was a great way for us to access the environment and to see how ready some areas were for change and to see where we needed to do more educating to help some consider possible changes. So some opportunities that we found throughout the tour was to work with the schools and our park and rec department to do healthy concessions or to do a sugar sweetened beverage policy. So from going out and seeing what they were offering the students, we actually made some changes. So our park and rec department is now, they don't provide sugar sweetened beverages, they have healthy vending. Some of the associations have a sugar sweetened beverage policy, so it was a great way for us to talk to those in the community that are serving concessions. We have some opportunities at our food shelf. It is not a self-select food shelf. And to also do some promotion because it is underutilized, mainly because of the location and the hours. So working with them to get the word out where they're located and what they all offer for the community. To do a better job engaging with our local growers. We set up some trainings afterwards, and again helped send out information of what the high school was doing and how they're selling at the co-op, as well as some other farmers that were selling their produce there. Childcare trainings, so the food program criteria changed for providers, and it was extremely hard for them to navigate, to know what they should even be feeding the kiddos for snack and lunch. Our dietitian, who did some research, felt that she was knowledgeable in that and set up some tours at the local grocery store and invited the daycare providers to it to help show them what they can purchase and what are some meal and snack suggestions for their daycare business. And then the senior service, so our senior center, again, not as utilized as it probably could be, so working with them to do some additional promotion, and as well just really promoting those local partnerships throughout our community. So another promotional piece that was created after this tour was this flyer on the right on how to create healthier meals and potluck choices. So we felt that this was another area that we could assist with. So we created this flyer and handed it out at World Day of Prayer, which is an event in March where our local churches all gather together for prayer and training. So we were happy we could get this into the packet, and we were really hopeful that they would read it and they would use it. But again, it was just a piece of paper that we handed out. So about a month later, after the World Day of Prayer, we received this email, and it's a picture from a local funeral that the pastor sent us. So you will notice it is not your standard Midwest potluck or funeral meal. There are no Jell-O salads, there are no mayo salads, and there is only one whipped cream salad. So the pastor was extremely happy. She said it's the first time she's taken a picture of food at any funeral. And she wanted us to know that after the funeral, in the past, a lot of those Jell-Os and those mayo salads, they have a lot of leftover that ends up going in the fridge, and then they end up throwing it away at the next day. After this funeral, they didn't have any leftovers. So it was a win-win for all. And we were really excited that creating the flyer at least made a change at one funeral. So.
And this flyer will be available to everyone as a part of that you can download, and it'll be associated with the link that John sends out after the end of this webinar. And so this is our contact information if you have any other questions and want to get in touch with us. But now we've got about 5 minutes for some Q&A. So does anyone have any questions for Jen or I about our Food Environment Action Team work in New Ulm?
Yeah, thanks, Cindy, and thanks, Jen. It looks like we have a few questions in the Q&A pod. The first of which is, how did you go about determining and setting up the food audit tour?
Yep, so we, as a committee or as a team, looked around to see who we didn't have at the table. And there were some places that we knew very little about. So we knew we had the senior dining. We didn't really know the hours or what it all entailed. So we really looked at what was happening in the community, who we still needed to talk to, and what those opportunities were, and then set up an agenda and really just called the different areas to see if we could come and tour their facility.
Excellent, thank you. Looks like we have one more question, and it is, besides identifying potential opportunities in the food environment, what other benefits did you see from doing a food tour?
Yeah, so we gained some partnerships when we did the tour. So the lady who works at the Lutheran Social Service, so the senior dining facility, wasn't a part of our team prior to the tour. We did the tour and felt that with her knowledge and expertise and with the aging population we have in our community, that she would be a fantastic fit for team. And we just gained some additional partnerships. So now people will send us information, know that we can help do some additional promotions. And then we also saw the need for some trainings. For instance, after this, we did a training for local farmers. And we wouldn't have probably known that there was a need for that without doing the tour and knowing that we have the right people around our table to help the training and to help create and have some of that come to life. It was just a way for us to get a better understanding of what was out there.
Excellent, thank you. It looks like we have a few more questions in the Q&A pod. And one of them is, have you started looking at any of the health data lately, and are you seeing any changes?
So this is Cindy, and the project ended in 2018, and we have started collecting that data. We do have some of the electronic medical record data. And we did get some health data. We're really looking at analyzing that, and we will be publishing those outcomes probably over the course of the next year. And we want to look at state level data as well, and that state level data also won't be available until 2020. So we plan on writing some peer-reviewed research and publishing over the course of the probably next 18 to 24 months.
Okay, thank you. And the last question is, have you created any materials or information for different cultural groups? And I think the question means, do you have any information that's sort of differentiated by cultural group?
Well, no, we haven't, because New Ulm is, we don't have a vast difference in cultures, unless you want to consider being non-German, a different culture. So yeah, our population is 97.9% white, so we don't have a lot of cultural diversity in our community.
Yeah. Yeah, thanks, Cindy. And that was a great question. So thank you guys for entering these questions. And it looks like that if those are all the questions we have, that it's time to wrap up here. So Cindy and Jen, I just wanted to say thank you very much for joining us and sharing your expertise. And thank you, our attendees, for joining us. And again, you can get more information about the Rural Health Transformation Center. You can access all of our tools and resources via the link that is posted in the chat pod. If you have any questions, feel free to email us at populationhealth@mhif.org. Again, that's populationhealth@mhif.org. Thank you again for joining us, and have a great day.